From the makers of vet-recommended Greenies dental treats comes an easy way to support your dog's wellness. Greenies Smart Essentials dry food delivers complete balanced nutrition with science-backed recipes. Greenies supplements, developed by a team of PhD animal nutritionists, offers options to help support healthy joints, digestion, and more. Whether it's mealtime or mobility support, Greenies helps you care for your dog from the inside out. Learn more at greenies.com.
This is Veterinary Vertex, a podcast of the AVMA journals. In this episode, we chat about how laparoscopic ultrasonography identifies more liver lesions in dogs compared to transabdominal ultrasonography with our guest, Francesca Solari.
Welcome, listeners. I'm Editor-in-Chief Lisa Fortier, and I'm joined by Associate Editor Sarah Wright. Today, we have Francesca joining us to talk about laparoscopic ultrasonography. I'm really excited to learn about this from you, Francesca, so thanks so much for taking time to be with us here today.
Yeah, thank you so much for having me. All right, let's dive right in. So, Francesca, your AJBR article discusses how laparoscopic ultrasound identifies more liver lesions compared to transabdominal ultrasound, and can be used to guide the biopsy of lesions that are not grossly appreciable laparoscopically. Please share with our listeners the background on this article.
In our veterinary patients, staging of liver cancer is hugely important in the management of these cases, and very critical to ensure that we're providing the best quantity of life, but also quality of life for our patients. And the modalities that we have for staging of cancer and liver cancer and specifically have drastically improved over the last couple of decades. We're very lucky to have, CT, contrast-enhanced CT, things like that are hands. But even those modalities with their improvements have been shown to fall short in several studies. And we miss liver lesions or we incorrectly localize them, and that can definitely alter the treatment recommendations and the prognosis for those patients. And so in human medicine, they use laparoscopic ultrasound in the staging of liver cancer, and it's been shown to result in better accuracy in picking up lesions more often than things like contrast-enhanced MRI, CT. So that's kind of what drove me to look at this in dogs.
And what are some of the important take-home messages from this AJBR article?
I think importantly, is that we have all of these different modalities. And this paper isn't to say that we should only be using laparoscopic ultrasound in staging of liver cancer, but instead it's just one more kind of tool at our fingertips to use in these patients. So still doing preoperative, transabdominal ultrasound or CT to stage and evaluate these patients, but then going that extra step as well to use laparoscopic ultrasound and make sure we're not missing anything on those preoperative imaging modalities. So I think that's the biggest takeaway for me. And as we're seeing kind of this increase in the number of pet owners who are wanting to, raise the standard of care for their animals, and we're starting to kind of see, more minimally invasive surgery options in our veterinary patients. And we're really kind of raising the bar of what we're doing in veterinary medicine, just realizing that we have, more and more things to make sure that we're optimizing our patient outcomes.
Yeah, my big take home, Francesca, from this atopical is get the diagnosis right.
Mm-hmm.
Like, people are like, oh, I tried that and it didn't work. I'm like, did you have the diagnosis or were you just shotgunning? And that's fine to start there. But if you really want to hone down and, like you said, make a precise patient-oriented specific treatment, then you need to get it right.
Yeah, absolutely. And it's actually not related to this paper, but one of my biggest pet peeves is the term idiopathic, because to me, nothing is actually idiopathic. It just means that we've missed the diagnosis.
Fair. Good point. What sparked your research interest in this? Was there a specific case or did you read about it in human literature? What drove you to start investigating this in veterinary medicine?
Yeah, well, I've been really lucky here at UF where I did my residency that I've worked with some fantastic mentors, both in life and in surgery and also in research. And I've worked primarily here with Dr. Brad Case, who's one of our surgeons and also very big in the minimally invasive surgery world. And he had done some work with microwave ablation of liver tumors. And one of the challenges with microwave ablation is you need to make sure that you're getting coagulation of the entire tumor, and you're using a little pinpoint needle to stick it in the tumor. And if you're not in the ideal spot or you don't do multiple ablation zones, you're not going to get complete necrosis or coagulative necrosis of that tumor. And so one of the things that kind of sparked the interest in using laparoscopic ultrasound of the liver was using it to optimize microwave ablation and even microwave ablation minimally invasively. So doing it through a laparoscopic approach. So that's really kind of what started it. And then diving onto the human side. And I think honestly, for a lot of the research in veterinary medicine, we are so lucky to have our human counterparts to look to and kind of help guide our research in what directions we go next. But there's just so much work looking at laparoscopic ultrasound on the human side and how it can maximize patient outcomes for minimally invasive surgery, and not just for the liver, for other kind of indications as well. And that just really spiraled into a couple of my research projects that I've done over the years.
That's fantastic. Yeah, I think in veterinary medicine, it's really, we inform human medicine too. So it's really a nice translational One Health approach.
Yeah.
Sarah asked you earlier what were some of the take-home messages, but always when we do studies like this, there's something that surprises us and then gets us to do another study. So what surprised you from this article?
Yeah, I mean, not a lot surprised me in the sense that I was anticipating we were probably going to find more lesions with the laparoscopic ultrasound, and it was going to be more sensitive just because we have our human kind of counterpart papers to look to, and that's what they've found. But I think the one kind of finding of the study that isn't really a major finding, but that interested me or surprised me, is that all of the lesions that we biopsied were benign. And, to some degree, that's probably patient selection, and that these patients were largely presenting for, chronic liver enzyme elevations, et cetera. But almost all of our patients had liver nodules. And I think that that's just an important reminder that as we get more and more diagnostics that, give us more information and maybe we find more nodules, even in a patient that has liver cancer, we need to be cognizant of the fact that, it doesn't necessarily mean they have metastatic disease. And so, part of the concept behind laparoscopic ultrasound as a staging tool is that it should be paired with biopsies and not just kind of used to condemn the patient and say they have metastatic disease without further evaluation.
Yeah, I mean, this isn't cancer, but I'm a equine orthopedic surgeon. On our side of the gate, people are doing ultrasound exams of, for example, tendons and ligaments on pre-purchase exams, and they're incidental findings, right? But the horses, use your word, condemned, and
Yeah.
it's like put it together with the whole function. It's not just an imaging test.
Yeah, absolutely. And I think it's this catch-22, right? Because as we develop more and we become more advanced in veterinary medicine, we get more diagnostics that give us more information. It's really important to remember, remember that we need to interpret it in light of the patient and correlate with our clinical findings. But also, remember why we're doing our diagnostics and why they're indicated, and not just kind of throw a patient in the CT, because you're going to find incidental findings.
Exactly. Choosing diagnostics based on what the result, if it's going to change your plan of action, basically. So, yeah, I even challenge my own cats veterinarians sometimes when I bring them in. I'm like, okay, so you want to do this chemistry panel? Well, what are we going to find on that? It's going to change our course of action, or are we just doing it to do it? So,
Yep,
good
exactly.
points. So, what are the next steps for research then for you?
Yeah, I mean, I think that this, where I would like to see this go is similar to the way that they do it on the human side. Is, the patients go through their preoperative staging, so they go through their CT, they go through their transabdominal ultrasound, depending on what you choose to do, and then before going to any kind of curative intent surgery, they undergo laparoscopic biopsies with laparoscopic ultrasound, because I think not only does that get us more information, we may find additional nodules, we get biopsy samples to know what the primary tumor is, but also to know if there's any evidence of metastatic disease. And then it could also even guide, our surgical plan. So we can evaluate the tumor laparoscopically, get an idea of, is this actually surgically resectable? Or is this something where we need to be considering a different type of therapy, like chemoembolization or radiation therapy. Is this something we can laparoscopically remove? So do like a laparoscopic liver resection. Or if we find that there's diffuse disease, then do we consider something like microwave ablation? And so really optimizing the specific treatment plan for each patient without just going in and doing a full exploratory laparotomy, and finding out that maybe we can't even surgically resect that tumor, or maybe it wasn't the best option for that patient specifically.
Do you see a role for AI in this area of research?
Yeah, I mean, I think there's so much room for AI in veterinary medicine, and we're already starting to see that transition. For this specifically, I think there could be a role, and I guess we'll see how AI kind of comes into diagnostic imaging over the next decade or so. But I think there could definitely be a role in trying to pick up those liver nodules, on the ultrasound, because one of the challenges that we faced in this study was you're looking at the laparoscopic image on the screen. So you're watching the video, but you're also trying to look at the ultrasound monitor separately. And so you're having to kind of go back and forth between the two. And so even though we picked up more nodules, we may have missed, potentially some liver lesions or liver nodules.
Yeah, really good point. You spoke earlier about the great mentorship that you have received in lots of different aspects of life and profession. How did your training and all that mentorship prepare you to write this article?
I think in a couple of different ways. I've been very lucky here at UF where we have a master's degree program. And so, our residency is a little bit longer, but it really affords us the opportunity to get involved in prospective clinical trials because, as I'm sure you know, those take time. They take a lot of energy. But I think that they give us very valuable information. And I think there's a time and place for retrospectives, but also, we need both prospective and retrospective studies. So being here and having that master's degree and having that extra time to do a clinical trial has really helped me with, doing this research. But also just having mentors here who are constantly willing to try new things and push the envelope a little bit. And then being across the street from Shands, UF Shands, which is the human hospital, and having people who, that One Health approach, like we mentioned, where we can chat with them about how they manage their patients. If we're trying something new for the first time, they can come over and help us. So I think that all of those things together have made it so that I can, do this type of research, which I feel very lucky.
Well, we love hearing that. So, Francesca, you shared a lot of really valuable information today with us. And now we're going to ask you something really hard to do. If you can boil it down to one piece of information, like veterinarian is going to go see a client, they're going to be talking about this. What is one thing they need to share with them? So, Francesca, what is one piece of information the veterinarian should know about laparoscopic ultrasound for evaluation of the liver in dogs with clinical liver disease?
I think for me, just knowing that it's an available option. And so, when a veterinarian is faced with one of these patients that either has, elevated liver enzymes or, has a liver tumor, realizing that referral for that kind of gold standard of care, getting more information or getting the most information we can before we dive into any kind of treatment is out there. And so just being aware of that.
And on the other side of the relationship, what's one thing that clients should know about this?
I think on the same note, just knowing that there are, options available for people and they can, have that further information about their pet and they can, think about the best treatment option for their pet before they have to dive into anything. I think having more information for owners helps give them peace of mind. So I think that to me is really the most valuable aspect for clients.
Yeah, one of my favorite sayings is knowledge is power.
Absolutely.
Francesca, thanks so much. This is really fascinating. I didn't know about this until I read your article. So thank you for sharing it with JAVMA.
Yeah, of course.
As we wind down a little bit, we like to ask just a more fun question. So for you, I would like to know, what is your favorite animal fact?
Well, I'm a big fan of otters. I love otters. And I recently found out that otters like to juggle. And they also like to save rocks that are their favorite rocks, and they keep it in their little belly pouch. So
I did not know that. We've heard that they sleep. I don't remember what it's called. They sleep holding hands so that they yeah.
Rats.
What's it called?
Rats.
Rafts.
It's like a little rats. Yeah.
yeah. They're fascinating creatures. They're not the nicest, though, actually, to people.
Yeah, Francesca, I came to the APMA from the Vancouver Aquarium. We had quite the robust otter population there. So they definitely keep you on your toes. That is for sure. They like to save their little rocks too. And sometimes they'll try to use it to like excavate out of their exhibits. So always keeping a close eye on them. They're very smart. Well, thank you so much, Francesca, for being here today and for also sharing your work with AJBR. We appreciate it.
Of course. Thank you so much, guys. I really appreciate it.
And to our listeners, you can read Francesca's article in AJVR. I'm Sarah Wright with Lisa Fortier. Be on the lookout for next week's episode, and don't forget to leave us a rating and review on Apple Podcasts or whatever platform you listen to.